I presented a phase 2 clinical trial in patients with endometrial cancer. We studied a drug called ACR368, previously known as prexasertib. This is a potent CHEK1/2 inhibitor. So in that phase 2 clinical trial, eligible patients had high-grade endometrial cancer with up to 2 prior lines of therapy who had relapsed after prior platinum-based chemotherapy and had 1 prior line of immunotherapy. And these patients were assigned into 2 arms based on the results of an oncosignature test, which is a tumor-agnostic biomarker that measures essentially the tumor's addiction to CHEK1/2 mediated DNA repair. And patients were assigned to 2 arms. In arm 1, that was the patients who had a biomarker positive tumors. These patients received only ACR368. And arm 2 were patients who had biomarker negative tumors, and they received ACR368 plus a low dose of gemcitabine. Both were given intravenously every 2 weeks. And the primary endpoint was to understand what was the objective response in arm 1, which was the primary arm. Arm 2 was the exploratory arm. And what the baseline characteristics were well balanced between the 2 arms. But what was interesting is that tumors of serous histology and P53 mutated tumors had a high degree of biomarker positivity and therefore were enriched in arm 1. The objective response, which was the primary endpoint of the study, was 39%. Disease control rate was 80.6%, and clinical benefit response, which included stable disease at least 16 weeks, was 61.3%. And when we looked at which were the markers that correlated with response, we found 2 things. First, patients who had up to 2 prior lines of therapy did better. And there, the objective response was 44% in arm 1. And the second thing was that patients with serous tumors, serous histology, who had up to 2 prior lines, their objective response was 52%, very exciting, regardless of whether they were biomarker positive or biomarker negative. In terms of toxicities, there were no unexpected toxicities or new safety signals compared with previous studies of this agent. And the main toxicity was essentially manageable, transient, mechanism-based hematologic adverse events, and there were no fatal treatment-related toxicities. So in conclusion, we found that this drug, ACR368, is active in the biomarker positive endometrial cancer, and that serous tumors show high objective response regardless of biomarker status. And we now have a new aim, an arm 3, which is evaluating this agent together with low-dose gemcitabine in an all-comer population.